Tia Graham. The Center for Community Uplift at the Brookings Institute has been measuring the quality of life for Black residents across the state of Michigan. Last year, they published a report that highlights a familiar narrative, a narrative that suggests Black residents own less homes, have a lower life expectancy, and make less money than the state average. But they also found that there are Black communities across the state in Kalamazoo, Grand Rapids, and some Detroit suburbs bucking that trend. So, Perry and his team at Brookings surveyed residents in those areas and others, and instead of asking about the challenges, the team wanted to know which policies and programs were working. Over 150 Black residents from Benton Harbor, Flint to Kalamazoo and Detroit responded. The team compiled that feedback and published a list of 29 policy recommendations in October of this year. To better understand what policies are strengthening these communities, the Metro's Kerry Jr. II had Perry break down some of those recommendations in the report.
A lot of what we'll be discussing are your policy and program proposals. We won't be able to get into all of them, but I do want to just understand what you and your team were looking to uncover when you initially surveyed residents in Michigan.
The lead question is what keeps you in this place? And from that, we asked residents, how can we build upon or accentuate those strengths? Too often, we focus on disparity and what's wrong with communities. And that's just, it's important to look at what's not working. But if you miss what's working, you miss opportunities to invest in the things that should be expanded. There were 4 major buckets. We wanted to look at creating opportunities for residents to build wealth. We also wanted to look at community-centered investment and development. Third, we wanted to support residents from childhood through entry into the workforce. And finally, advancing health equity through expanded access and services. So those are the 4 big buckets. Throughout, we targeted many different policy priorities that the communities and the state, quite frankly, can take up to improve the quality of life of residents throughout Michigan.
The recommendations, they focus not only on Black majority cities, but also neighborhoods. Why is that?
Because oftentimes, because of past segregation, Black folk and white people are concentrated in particular neighborhoods. A lot of that has to do with history. And so oftentimes we may not focus on a majority Black city, but those census tracts, those areas where there's Black people, they're highly concentrated in those areas. And oftentimes those are the places where you see a lack of investment. But I also need to put this finer point on it. When we're talking about investments in Black communities, this is not a zero-sum game. And this is not sort of, we're only going to invest in Black people. No, this is about investing in the places where Black people live. Because of past discrimination, the proximity to Blackness leads to less investment in those areas. But in many of these cities and towns, white people live there too, Latinos live there too. We're not talking, say, to reinforce segregation in any way. What we're saying is that these places need investment. And as these places grow, so do all residents within them.
All right, so let's hop in. The first group of priorities is creating opportunities for Michigan's Black residents to build wealth. The problems you list here is racial wealth gaps between Black and white households, the poverty rate in Black majority cities is twice that of the states, and that the cost of housing represents a burden on Black families, those among others. What did you hear from residents about the barriers they faced and opportunities they wanted to see as it pertains to these particular issues?
Yeah, when you're talking about the median household income across Michigan, it's about $69,000, but in Black majority places, about $41,000. And when you talk to residents, you hear it in They're wanting for more home ownership opportunities, business opportunities, banking opportunities. That really surfaced almost immediately was people wanting to expand or increase the level of Black business ownership in communities. But one of the barriers was, quite frankly, a lack of access to capital, and that's always the issue when you how the wealth gap shows up in terms of home ownership and business ownership is a lack of collateral, lack of a down payment. And so one of the chief policy recommendations to increase Black business ownership is to increase the presence of local financial institutions, in particular CDFIs, community development financial institutions, and credit unions. And we've seen community-facing banks leave communities all throughout our cities and towns. In particular, they've exited Black majority places, and some, but there's not a lack of financial institutions in them. They just don't, or people just don't want extractive ones. The check cashing places and other financial institutions that take large sums of a person's income. And so one of the recommendations is to increase the number of CDFIs and credit unions. During the pandemic, it was the CDFIs, it was the credit unions that found ways to distribute loans to businesses in neighborhoods. And those businesses began to thrive.
How would you increase the number of CDFIs, these institutions in the state of Michigan? What's the process through which that can be done?
Yeah, and so this is really about getting CDFI leaders to see the value in having a branch in an area. So some of this is around recruitment. You see economic development organizations all the time recruit various businesses to a place. We need to recruit financial institutions to various places as well. We know that they can pencil, meaning they could figure out ways to be sustainable, because we have financial institutions in many Black places. They're just more of the extractive variety. And so we know we can figure this out, but certainly some of this is about figuring out recruiting them to go to the majority Black places in throughout Michigan.
I see.
Now, I want to also just talk about increasing access to affordable and safe housing.
That's perfect. That was really where I was going to go next.
Yeah. Housing came up over and over and over again. And there's two things. There was a conversation about affordability and a conversation about ownership. Now, there's some overlap there. Residents wanted to figure out ways to become owners and figure out ways to increase funds to refurbish some of the vacant properties, that if there was some type of fund to refurbish these homes, they would purchase it. And so certainly they want to expand programs to purchase, renovate, and retrofit the available housing stock for Michigan residents. That came up over and over.
Are we talking access to loans? Are we talking about grants? What kind of funds do people?
It's all of the above. It's all of the above. Many of the housing authorities have funds to do just that, to either provide to potential owners, to help them refurbish a home that's in disrepair. There are certainly microloans that can happen to help potential homeowners. But then there are first generation home buyer programs that we see throughout the various states, including Michigan. So some of this is just to bundle these efforts. And by the way, Michigan actually has many of these programs in place. It's really the residents said, "Hey, we want more of it. We want to see an expansion of these programs." So, and then there's various housing plan. There's Michigan statewide housing plan, prioritize racial justice, and renews a commitment to build 15,000 housing units. That's 115,000 housing units. They want to see that the state stay with that commitment.
And it sounds like you're saying because the state of Michigan has some of these programs in place, you're saying these need to be expanded. Either more funds need to be allocated towards it. They need to be in places, more places across the state, not just in major cities.
Yes, and what the residents are saying is somewhat a validation of what the state is already doing. I think they are certainly saying, let's expand, let's keep going. We have momentum. Let's keep the pressure up.
You're listening to The Metro on 1019 WDET. I'm Kerry Jr. II. My guest is Andre Perry. He is a senior fellow at the Brookings Institution and the director for the Center for Community Uplift. He and his research team recently published a report recommending programs or policies that Black residents across Michigan wanted expanded. These programs address factors like housing and food and health. All right, so this next group, community-centered investment and development. So there is an environmental component to this policy umbrella, I'll call it, a block club component, an effort to increase third spaces and transit. There's a lot going on in this one. But because we already kind of discussed environmental pollution, public transit a lot on our show, I'd like to kind of focus the aperture of this umbrella on your ideas for supporting neighborhood organizations and protecting community gathering places. So first, why are each of those important to develop, and what have the respondents said about those spaces and about neighborhood organizations?
Yeah, when we ask, what keeps you here? Oftentimes people talked about their block clubs, their social aid pleasure clubs, the local organizations, the gathering spaces. And they really want to see an investment in those places. Some of it is, investing in the actual physical club itself or the park, the area. But there's a recognition that people want to gather. They want to be communal, and they want to invest in more of that activity. This is something, I really applauded because people said, particularly in the post-pandemic, there's a want and need to see people, to touch people, to talk, to gather. And respondents really talked about the benefit of neighborhood associations and block club.
What did they say?
Yeah, they say those are the organizations that hold them down when times are tough, when they want to hear about the news in the community. They go to their block club when they want to contribute to back to school drives and volunteer opportunities. They go to their block club. And when it's hot and people want some relief, they go to the local community gathering spaces to either cool off or to talk with people about the daily events. And so there's just a passion for their places. And particularly when asked what keeps you here, they said, hey, I can't go a week without seeing my friends. I can't go too long without playing cards with my colleagues. So these kind of places are important for human development and as well as community development.
As it pertains to block clubs, what's the policy here? Like, I would imagine a block club is something that is built by the community itself. They come together and say, hey, let's start a block club. Let's gather. Let's recruit. When you say they want more investment in that, what does that investment look like?
Some of it is getting the block clubs to actually be a part of and engage with economic and community development activities. When when there is a plan to bring business to the city or the town, oftentimes we don't engage with the block clubs, the people who are right there. So some of this is not necessarily about resources; it's about getting the block clubs involved in planning. But they also did mention starting neighborhood matching fund and block club funds, which these neighborhood associations could tap into for activities. I remember anecdotally that someone talked about hosting a community dinner on occasion, just to get people out of their homes. And if they could get access to some funds to have a community dinner, I thought that was a brilliant, innovative idea. Hey, bring people out, have just a conversation, lead with some questions for the audience. But really, it's just a reason to get people together and build community.
Did you find that there were enough block clubs, community organizations, neighborhood organizations throughout these cities across the state? And so that the only step that we really needed to take was to make sure, as you said, that those organizations are the actual connection and communication point for investment? Or is there also needs to be some sort of, we need to generate more of them? And if that is true, how?
Yeah. There, it varies from neighborhood to neighborhood. Some communities really don't know what a block club is, and others it's central to the neighborhood. And so residents also recommended providing funds to start block clubs. And this is important because we do need neighborhoods to cross-pollinate a little bit, that they neighborhoods need to learn from each other what works, what doesn't work. And so certainly some of the funds will go to enhance already existing block clubs, but other funds will go into starting block clubs and neighborhood associations.
Coming up, Perry continues outlining his recommendations for communities in Michigan. Plus, have the people who can implement the report seen it? That's next on The Metro. On WDET, I'm Tia Graham. The Center for Community Uplift at the Brookings Institute published 29 recommendations from Black community members across the state. Cities like Kalamazoo, Benton Harbor, and the suburbs of Detroit. They want to identify the programs that have helped residents improve their quality of life and expand them. Andre Perry, the director of the program, explained their findings with the Metro's Kerry Jr. II. Let's get back into the conversation.
I want to move now to your recommendations about supporting residents from childhood to the workforce. This category includes issues like child care, wraparound services for students, workforce development, and reentry for people who have interacted with the criminal justice system. What concerns did residents raise as it pertains to these issues?
If there is an area that there is consensus on, is that residents want to take care of the future of their towns and cities. They care about the children. In particular, they want to fund the programs and initiatives where there's evidence of growth. Flint RX Kids came up, and these are investments in low-income families that help children and parents increase their quality of life. There was some just thinking around traditional programs and initiatives like pre-K and after-school programs. A lot of conversations about investing there. More child care facilities. That was certainly a demand. That the price of child care is really reducing the amount of discretionary income that they can apply for other things. And then in that area, they talked about paying childcare workers more. That many people who are familiar with the childcare industry noted that preschool workers are really devalued in terms of their pay.
But as it pertains to ensuring an effective reentry strategy for people who have a history with the criminal justice system, which policy recommendations that you list, which one do you think is most pertinent?
One, there needs to be just a recognition that when people are released from some type of incarceration, some type of facility, that they're running uphill. Many returning citizens simply do not have housing, so they are called for housing vouchers and a housing placement program for folks who have been involved in the criminal justice system. They want to make sure that every individual has a state issue identification when they are released. Oftentimes, they do not have basic IDs. Those are just some of the recommendations. Certainly, you want to upskill folks, but at the end of the day, what really stops recidivism is a good job, good training. Once people have opportunities, they don't seek opportunities that will get them back into jail or prison.
What are we seeing in Michigan that's going in the right direction that we need to either expand by funding or expand in terms of, it needs to be in multiple other cities across the state?
I really like Kalamazoo's K-PEP program. They offer alternatives via workforce development. So there's a lot of workforce training that they do. There are programs such as Nation Outside. They serve about 2,200 participants, and they deal with a lot of trauma-informed counseling, and they help those who were formerly incarcerated find jobs.
And so the final section here of recommendations we'll discuss is about advancing health equity. So this touches on access to health care, healthy food access, and mental health services. This is something we've discussed, and it always comes up as central to a lot of what residents need to thrive. What did residents say about what they needed in the state of Michigan?
When it comes to health, this is one of the areas we're not going to just nonprofit our way out of these problems. This is something that requires the full weight of the federal and state governments. Right off the top, got to fund Medicaid and SNAP. Make sure we do that. And then along those lines, we do need to increase access to healthy food sources. That was another recommendation. Too often there are food deserts in our communities and even if you assume that people have access to their sort of mobile apps and the apps that get access to those foods, they're more expensive.
Mm-hmm. You're listening to The Metro on 101.9 WDET. I'm Kerry Jr. II. My guest is Andre Perry. He is a senior fellow at the Brookings Institution, and his research team surveyed Black residents across Michigan about the programs and policies that they want expanded. They then published a report and recommended 29 different policies or programs. Now, you also recommended a change in zoning laws so that there is more opportunity for stores and potentially urban farms to be in cities. Can you just talk a little bit about that direct kind of policy recommendation?
Oh, yeah. And I should have mentioned that when I said that we're not going to just nonprofit our way out of this, that many areas are just not zoned for the kind of facilities, stores that would allow for access to food. And so we need to rezone in ways that will encourage people to grow food, to sell food, healthy food, I should say, and other services that are within walking distance. Walkable neighborhoods are a positive predictor for life expectancy. And so we really want to increase those opportunities. So, and some of that requires new zoning ordinances. And then, but finally, I want to just talk about mental health. People
Yeah.
talk about the mental strain that many of the neighborhood conditions are causing on families, and they want to they wanted more mental health and substance abuse care facilities throughout the state, and they noted organization Every Woman's Place, which counsels domestic and sexual violence survivors in Muskegon, and Integrated Services of Kalamazoo was cited throughout the visits and throughout the state, cities and state. People talked about having organizations and outlets to deal with mental health issues. And that goes along to train more social workers, therapists, and physicians to work in Black majority cities. People want workers there, want to serve those communities and address those needs. But certainly there's been an increase in the perception of mental health services. I mean, for the better, that it's less taboo, but it is still taboo in many places.
Mm-hmm.
People will say, will not see a therapist. And the same people may say they will not see a doctor or a physician, I should say, for another physical element. But we have to change that. That when you're struggling and it becomes apparent, or if it's not apparent, that there are areas and options for you to get checked out. And so that's something that just came up over and over again in the conversation.
People may read this report and think, well, boy, it's going to take a lot of meetings and advocacy to get any of this passed, especially as the jurisdictions expand to a county, state, or even federal level. What do you say to people who don't believe the government works well enough to get this done?
You know, about what I love about this report, what Black Michiganders say their communities need. There's so many recommendations that can be taken up at the neighborhood, city, or state level. That certainly there are some recommendations that will require the state to be involved. But there are others where neighborhoods can implement. Any report that's worth anything, it enables people to organize, convene, and to plan.
Mm-hmm.
That's what this report is all about, giving people opportunity to organize, convene, and plan.
Will the report go to local officials who could implement these recommendations?
Yeah, well, I mean, I will say that I've been a little bit overwhelmed with the response. We've gotten requests from city officials, neighborhood organizations, and part of this work we will be circling back to many places. The work is not done, and we will be going back and trying to figure out implementation strategies. I'm a part of many different efforts throughout the state. And so I'm looking forward to reconnecting with many of the residents, say, okay, we have this plan. Let's use it to get some things done.
How do you make sure, considering these are interdependent, all of the policies are implemented? Any concerns that only some may be implemented while others may not?
Now, in all four categories, and just to review, creating opportunity to build wealth, community-centered investment and development, supporting residents from childhood through entry into the workforce, and advancing health equity. In all of those buckets, there are experts and community members engaged in this work at the policy level, and they're going to work somewhat discreetly, separately on these issues. Every once in a while, they'll come together to cross-pollinate. But policy making is not linear. All of these things are going to happen at the same time with the same effort. With that said, I do think this report can inspire those experts in those areas to come together to see how they can support themselves. And oftentimes around elections, they do that. They come together to say, hey, we're part of an agenda. Let's hope that this report can contribute to that coming together. But these things aren't linear. That policy making is it can be staggered a bit. And so I would not be surprised if some of these efforts saw more uptick than others.
Andre Perry is director for the Center for Community Uplift at the Brookings Institute. He spoke to Kerry Jr. II about their program and policy recommendations for Michigan communities. Coming up, a local business was named to the top 50 best clothing stores in America by New York Times. We'll learn more about coup d'etat and what makes it unique. You all stay right there. This is The Metro.